Okay, I'm going to kick it off to John Fox, the president and CEO of Beaumont Health. He's going to give some brief remarks, and then after that, John will turn it back over to me, and then I'll call on reporters individually for you to answer your questions. This will be 30 minutes. We're on a tight timeline, so we need to wrap it up at 11:30. John?
Thank you, Mark, and good morning, everyone. Thank you for joining us. As Mark alluded to, let me read some brief comments to you, share them with you, and then we'll open it up. As I think you're aware, today we announced that Beaumont Health and Advocate Aurora Health have mutually decided to end our current partnership discussions. As you recall, in June, we had entered into a non-binding letter of intent with Advocate and Aurora, and that was going to lead us to a due diligence phase and a lot of other expanded work across our organizations. But this has all been in the middle of a terrible pandemic, which has greatly hindered our normal interpersonal interactions that you would have in this kind of a process. And it was really essential for community-based organizations to build relationships and get to know each other. Again, those with deep community roots like Advocate Aurora and Beaumont. A simple example of that, frankly, is that our boards have never physically met yet. We've tried Zoom a couple of times and other mechanisms, but it's not really been adequate. In addition, over the past few months, we have listened to the perspectives of many physicians, nurses, staff, donors, elected officials, and community members about a variety of topics and their concerns about a potential partnership with Advocate Aurora and Beaumont. And we very much appreciate their candid feedback. And all of that, frankly, was overshadowed by both COVID issues and non-COVID issues. We also recognize the many people that were excited about the numerous opportunities we discussed as part of the potential partnership. In addition, healthcare is going to continue to evolve rapidly. The pandemic has accelerated change in our industry, and we anticipate the pace of change to continue to increase going forward. And again, this is all part of our current environment. And just to give you an example also that how sometimes these partnership discussions work, last year there were 6 partnership discussions across the country that were discontinued for a variety of different reasons. And frankly, I don't know of anybody who's been able to proceed in the COVID environment currently around the country. We approached a potential partnership with Advocate Aurora from a position of strength, as they did, and we all still remain strong. We are a respected, high-quality healthcare organization with extremely talented physicians, nurses, and staff. And moving forward, we will continue to execute on our strategic plan and explore additional ways to serve our patients more effectively and enhance our leadership here in Michigan. I'm very proud of Beaumont's extraordinary and heroic efforts throughout the pandemic. We cared for more COVID-19 patients than any other health system in Michigan. We will help lead Michigan out of this pandemic as well. We still have more COVID patients than anyone else in Michigan. We are preparing for the potential of a second surge right now this fall, doing a lot of work on that. Again, that takes priority over partnerships discussions. As an additional note, we're also preparing for the vaccine phase that we hope will come in the first quarter. We have right now ordered and are building inventory for 2 million hypodermic syringes that we believe will be needed for vaccinating patients in the first and second quarter of next year, and we want to be ready for that. As always, we are committed to serving our patients and families here in Michigan. We truly have an outstanding team at Beaumont that has been recognized repeatedly by many organizations around the country and locally. And with that, I'd now like to turn it back over to Mark, and we'll stand for your questions. Thank you.
All right, like I said, thanks, John. I will call on all the reporters by name, and you can ask your question, and we'll go from there. So let's start with Mark Cavett from the Oakland Press. Mark, are you there?
I'm all set. Thank you.
You don't have, okay. All right, Karen Bouffard from Detroit News.
I'm all set too. I don't have any questions yet, but maybe some of the other reporters will make me think of some.
All right. Jay Green from Cranes.
I got a couple of questions. On the mutual aspect of stopping the talks, my interview with Jim Skogsberg led me to believe that he was deferring to you on the pause in talks in August and really was taking the lead from you. I wonder, isn't it more true that Beaumont decided to halt the talks and then Advocate agreed?
I don't know whether it's, I'd say it that way. We discussed it. We agreed that it would be a mutual decision. Clearly, we had a lot of groups we needed to process with, and it was extremely cumbersome with the pandemic. So again, we stand by what we said.
Okay, one more quick follow-up. I understand you led off with the pandemic being the cause of the termination of the talks. I wonder how much of an effect the doctors and nurses, the donors, some of the legislators had on those talks. It seemed like some of the board members were starting to have second thoughts about going forward with it. And I just wonder how much of an effect were the community people and the doctors in your decision?
I mean, it's all kind of one ecosystem. It's very natural when you start to discuss these kind of partnerships with a major community asset such as Beaumont Health that there'll be some initial concerns. The pandemic gets in your way and the ability to process that, what would have happened in a normal situation, and I've been involved in a lot of other merger discussions, as has Advocate and Aurora, we would have had a lot more meetings take place. I'll give you an example is there would have been at least probably dozens of meetings we would have held between and amongst our physicians. We've had a few of those. Those have been Zoom meetings, which are always a little awkward. And it's just not been able to process. So I'm not saying the pandemic is the cause, but it really got in the way, if you will. And the other issues are what they are. Legitimate concerns, but addressing the concerns and processing that, you know, with all the requirements we have under the pandemic is very difficult. And I think is shown really around the country.
Okay, thanks, John.
All right, JC, Free Press.
Yeah, I'm sorry, I missed the first part of the presentation today, so I apologize if I'm making you repeat anything. But so it sounds like COVID was the part of the reason for this. What were some of the other concerns that were out there that led to the decision announced today?
I think that, frankly, the board and management, and I endorsed the decision, looked at all the issues from all the constituencies, all the processing we needed to do, the issues we face going forward, that being a second surge, getting ready for the vaccine phase in the first and second quarter. And the collective decision was, we need to discontinue these discussions, focus on that, and get on the other side of this pandemic, and then see where we are at that point in time.
Could the discussions pick up again once we're out of COVID-19?
Anything is possible. I'm a little careful in predicting the future, but it's again, it's just right now. And this is true nationally. When I talk to my colleagues around the country who, like us, may have been in conversations in 2019, but have been interrupted, distracted by their primary responsibility for their communities, which is to protect them from the effects of the pandemic and to treat those infected with the pandemic, with the virus. Those activities are just pushed to the side, and that's just our reality.
All right, Zach Clark, WWJ. Zach, WWJ Radio, any question? All right. Tim Morrison. Tim Morrison? No? All right. Let me see who else is on here. Does anyone else have any further questions? I believe everyone has asked a question at this point. Are there any other additional
This
questions?
is Karen Buffard.
Yep.
I do have a question now. You know, in retrospect, you know, I'm wondering about the damage that may have occurred in the relationships with your physicians and staff members. To kind of bring up these merger talks during the pandemic, you know, it was a very high stress time for everyone involved. And I'm wondering if perhaps the decision to sign that letter of intent in June, you know, in a really still very bad time for the pandemic, I wonder if you have any hindsight about whether that was such a great move. And I'm wondering if you have any special plans to try to heal the discord that's occurred with the physicians and nurses and other staff members that occurred because of those talks coming up at such time.
That is a very good question. And I think it's the, you know, hindsight is 2020 for all of us, and this is across healthcare. When we got through that initial surge in the spring of 2020, we wanted to get back to what we had been working on our strategies and continue to advance the organization. What has become very clear right now is the adrenaline that got us through the surge. And it truly was adrenaline for all of us working 7 days a week, 14, 16 hours a day, plus, you know, all the frontline caregivers, is we're now out of the sprint part of the pandemic and into the marathon, and it really deals with cumulative exhaustion. I think for the physicians who are really, you know, challenged, about half of our physicians were all hands on deck, directly involved in treating the flood of COVID-19 patients that we had across our system. Another half, approximately, really had a lot less activity to deal with because of 85% of the surgeries being eliminated, things like that, if you will, in the heat of the battle. On their behalf, they had a lot of stresses. The Paycheck Protection Program, which was helpful to a lot of practices, capped their compensation at $100,000 per year annual rate. So they were taking, you know, those kinds of cuts and wrestling with that. Again, I've talked to physicians around the country. We've got to be very careful in healthcare about measuring the cumulative effect of this pandemic and its wear and tear on physicians, staff, and all of us, and really make sure we've got each other's back and help each other out. With the staff and with the physicians, you know, what happened at Beaumont is when we got our first patient on March 13th and then shot up to over 1,200 patients within 3.5 weeks, we flipped from being a very large med-surg health system to one that was 65% COVID-19. And we basically disassembled our old world at a very rapid rate, closed ORs, converted them to ICUs, any place we could find negative pressure. We grew our ICU beds by 40%. And again, a lot of it was, you know, with adrenaline, if you will, and the crisis of the moment. When you get away from that, and really, we didn't dip below 500 COVID patients until 2.5 months later. And, you know, with that, you know, we then entered what I call the marathon phase, which is very challenging. You know, when I go out and I talk to physicians and staff, issues of having a child schooling at home and 2 working spouses and that kind of stress. It spikes up our absenteeism. And frankly, recruiting people in this labor market has become much more of a challenge. That's a national issue across a lot of industries. But it's, again, as we try to put it back together again and get back to more of our pre-COVID operations, it's very challenging and it's stressful. I go up on the COVID units, I talk to staff, and you try to make sure that they're getting the help they need, the support, and frankly, time off and time out of the unit. Again, when we were in the heat of the surge, particularly at Beaumont, since we took the brunt of it for the state of Michigan, it was an extraordinary time.
All right, thank you, John. Last call. Does anyone else have any final questions?
Hey, Mark, can I ask another question? It's Jay Green.
Sure.
Yeah, actually, this is a 2-part question. John, do you have any plans to resign over this or retire next year? I know your contract is coming up. And also, you're quite aware that these issues have been changing Beaumont's physician and nursing staff, their opinion of management for some time, more than a couple of years. So I'm wondering, is Beaumont going to address some of these issues raised by the doctors and nursing on staffing, on support, on equipment, on contracting issues, including the anesthesiology contract, and also the new, the employed compensation program you're rolling out?
Well, again, you asked a compound question. I believe we're addressing all those issues. I'm not going anywhere that I know of. And fortunately, I have a lot of support from the board as we navigate through that. Again, do not underestimate the stress everyone has been under, courtesy of the pandemic. It has truly been extraordinary in our lifetimes. The anesthesia issue is a tough one in that, again, the facts are pretty well known that in 2012, the Royal Oak, Troy, and Grosse Pointe physicians, anesthesiologists had a private practice, sold it to a national company, which was unfortunate in a lot of ways. Anyway, roll forward, that's been recapitalized and, if you will, traded a number of times. Just recently, their practice was sold to a company, a private equity company out of New York. It's known as Napa, but it's owned by 2 private equity firms. And we tried to come to terms with them, an agreement, but we could not. But our intent is to keep our anesthesiologists. We've now have another 90 days to go. We've signed up over half of them, and we've seen the contracts. I've seen the signature pages, as have others. And we hope to be successful. We were successful in the legacy Oakwood hospitals and implemented that a couple of months ago. And we think we'll be successful going forward. There is a lot of tumult, and there's general concerns which are very valid. There's some sub-agendas with respect to other issues that physicians may have. But what we're doing is keeping the dialogue wide open. We're talking to them and we're working it through.
All right. Thank you, John. Anything else you want to add before we wrap this up?
No, I just want to thank you all for your time and stay safe. Obviously, the pandemic hit a new milestone in the last 24 hours in the political scene, and we'll see how that plays out. But again, this is an extraordinary event in our lives. It'll be fascinating to see how the history is written with respect to the COVID pandemic 19 in terms of its impact on America and its longer term impact, because this story is not over by a long shot. But thank you all very much, and please stay safe.
Thank you.